My Lords, the risk from tick-borne encephalitis virus is assessed as very low for the general public and low for those visiting, living and working in areas where infected ticks have been found. Lyme disease is the most common tick-borne infection in the United Kingdom. Tick awareness campaigns are planned for early 2020 ahead of the seasonal increase in tick activity in the UK and will include information on tick-borne encephalitis and Lyme disease.
My Lords, the history of Lyme disease, which is a bacterial infection called Borreliosis, has been riddled over many years with mistakes of understanding, recognition, testing, diagnosis and treatment. Now that TBE, or tick-borne encephalitis, which is a viral infection, has reached the UK for the first time, it's been spreading westwards across Europe steadily for several years, it's reached us. What is the government doing to make sure that the mistakes that have been made and are still being made on Lyme disease are not made on TBE, and in particular that they're not that new instances of TBE are not mistaken as being Lyme?
The Noble Lord is very right to raise this issue. We have been active in making sure that action is taken quickly. Tick bite avoidance is a key message in this area, and it is the same for TBEV as it is for Lyme disease. PHE has been working with local authorities and key stakeholders in the areas, informing them about TBE and the tick toolkit documents and guidance so they can remind the public and their staff and visitors to be tick aware. There will also be specific awareness campaigns that will come forward in spring 2020, and the material for these campaigns will include information on Lyme disease and on TBE. In addition to that, there will be research programs that will go on about TBE to ensure that we are as aware as we can be about TBE in the UK. But I would just like to be clear that there is only one probable case of TBE infection that was diagnosed by a European visitor bitten by a tick in the UK. The case is probable, and at the moment this is a very low risk to anyone in the area and to anyone in the UK, and a low risk to those in the area.
I don't wish to be, my lords. I don't wish, my lords. My lords, I don't want to be alarmist, but the discovery of tick-borne encephalitis virus in the UK is worrying. The tick vectors of this viral infection are widespread throughout the UK, maintained on a whole variety of animal hosts, including wild deer, which are now extremely common in lowland as well as upland areas. My lords, the number of clinical cases in Europe has steadily been increasing, and whilst it is true that something like 2/3 of cases are non-clinical, as many as up to 10% of those infected may suffer severe neurological sequelae, especially children, and my lords may also like to note especially the elderly. May I ask the Noble Lord, the Minister, will the government reintroduce the mandatory treatment, tick treatment of pets imported into the UK under the pet travel scheme? And secondly, is the Noble Lord satisfied that we are doing all we can in the UK in terms of research and preventative actions with regard to biosecurity to safeguard animal and human health in this era of climate change and globalisation?
I thank the Noble Lord for that question. I generally identify as a Noble Baroness. But in order to respond to his question, we are continuing surveillance studies for TBE in ticks and in wildlife, and we plan to monitor the prevalence, distribution, maintenance and spread of TBE in the UK to ensure that we have oversight of the situation as it goes forward. In terms of the risk assessment. We have based our understanding of the risk assessment on the recent experience in the Netherlands, where TBVE was recently identified. The estimated risk there of Lyme disease from a tick bite is 1 in 50. The estimated risk of TBVE from a tick bite is 1 in 500,000. That gives us a sense of the risk level. In terms of us doing the amount of work, we have a national contingency plan written to deal with vector-borne diseases and understanding the effect of climate change, which gives us a sense of the challenges that we face.
My Lord, the work of the National Encephalitis Society, which is based in Malton in North Yorkshire, of which I have the honour to be a vice president. Will my noble friend update the House on what work is undertaken to help doctors identify the difference between meningitis and encephalitis so that the swiftest possible treatment can be given? My husband was one of those who suffered encephalitis in his 20s. There are many of those who are less fortunate who don't make the recovery that he has.
The Noble Baron is absolutely right. I'm very happy to recognise the organisation that she recognised. In the first place, the Tick Toolkit and the work of PHE is in place in order to raise awareness. In addition to that, there is work going into providing advice to professionals so that early diagnosis is possible.
My Lords, one of the problems with Lyme disease is that the symptoms that it causes mimic a whole range of different viral infections, and many of those are much more common. And I wonder whether she feels the government's doing enough to raise awareness of Lyme disease amongst general practitioners, and also whether she is satisfied that the screening tests, which I think cost around £60 a time, are sufficient.
Well, the Noble Lord is quite right, and he understands this a lot better than I did. Obviously, NICE published guidelines for health professionals in 2018 in an effort to ensure that there was prompt diagnosis of Lyme disease, because obviously if it is recognised promptly and treated with antibiotics, acute Lyme disease is usually resolved without further complications. I will take away the question about the cost of the test in order to consider whether that has been a barrier. We have no evidence about that at this time.
Awareness is critical, and many are completely unaware of the risk when they go out for a walk. What actions will the government take to ensure organisations such as national parks, national forests and National Trust have a part to play?
We will be running tick awareness campaigns in the spring. Material for these campaigns will include information about Lyme disease and TBE. It will be run in all areas that have been identified as at risk as part of the surveillance campaign.
My Lord, how much research is the UK doing with other European countries who may know much more about these conditions?
As part of our surveillance work and the work at PHE, there is constant contact between the UK and other public health bodies across Europe to understand the risks, but also understand the most effective interventions. Of course, there are 2 specific studies looking at evidence of past TBEV infection in people and to understand the best interventions amongst the general population.